So hi friends, this is Sridevi Nursing Officer at AIMS Mangalagiri. So finally I came with another video. In this video I will tell you what are all the questions they have asked in the ESIC Nursing Officer exam along with the answers. So I have divided this paper in three parts, part 1, part 2, part 3. So part 1 I was discussing 50 questions which is from 100 to 150. So before going into our video, if you think this is useful video, please don't forget to like, share and subscribe to our channel. Let me start our video. So first question is matching question, which is list 1 and list 2 we need to compare. So in this list 1, threatened abortion, missed abortion, incomplete abortion and complete abortion. So here we need to match list 1 and list 2. So threatened abortion is equals to fetus alive and retroplacental hemorrhage. So missed abortion means a fetus without cardiac activity and incomplete abortion means production of conception partly retained. So complete abortion means a uterine cavity empty. So here we will match like this, means it will comes as a option A is the correct answer. 3142 is the correct answer. So move on to next question, that is 101 question. Daily requirement of calcium during the pregnancy and the lactation is option A 500 to 1000 mg, option B 1 to 1.5 gram, option C 1.5 to 2 gram and option D more than 2 gram. So here answer is option B 1000 to 1.5 gram is the correct answer. Till 1000 we can give for pregnancy and 1.5 gram we can give it in a lactation mother. So that is option B is the correct answer. Next one or two question. Presence of functioning endometrium inside other than the uterine mucus is called as option A uterine polyp, option B adenomyosis, option C Paget's disease and option D endometriosis. So here answer is endometriosis. Next move on to 103 question. Which one of the following is a non-steroidal compound with a potent anti-estrogenic properties used for a oral contraception? Option A progestin only pills and option B levonorgestrel, option C desogestrel, option D centroman. So answer is option D centroman is the correct answer. Move on to 104 question. Active management of third stage of labor includes option A administration of oxytocin 10 units IM, option B creates expressions of a placenta and option C administration of carboprost IM, option D administration of misoprostol 1000 nanograms per rectum. So here answer is option A administration of oxytocin 10 units IM is the correct answer. Move on to 105 question. So option A endometriosis, option B adenomyosis, option C bicornuate uterus, option. Here is one more matching question. List 1 and list 2 we need to compare. So list 1 is first degree, second degree, third degree procedentia. So here first degree is indicating of uterus descends down from its normal anatomical position but the external os remains above the introitus. So option second degree indicates the external os protrudes outside the vaginal intracoitus but uterine body still remains inside the vagina, and third degree indicates the uterus cervix body and the fundus descends outside of the introitus, and D procedentia indicates uterus prolapse with a eversion of entire vagina. So here answer is option A is a correct answer. 4321. Next question 107. All of the following are the causes of menarche except option A androgen producing tumor, option B pelvic endometriosis, option C adenomyosis, option D granulosa cell tumor of the ovary. So answer B pelvic endometriosis is the correct answer. Next 108th question. In the neonate the brown fat is located at the following sites except option A around the heart, option B in the axilla, option C around the brain, option D around the kidney. So answer is option C around the brain is the correct answer. Move on to 109 question. The normal respiratory rate of the newborn is a 14 to 18 breaths per minute, 30 to 60 breaths per minute, option C 50 to 70 breaths per minute, option D 20 20 to 30 breaths per minute. So here answer is option B, 30 to 60 breaths per minute is the correct answer for 109th question. Next move on to 110 question. A persistent rise in the PCO2 and decreased in the pH level in the newborn is a indicative of option A, metabolic acidosis, option B, respiratory acidosis, option C, respiratory alkalosis, option D, metabolic alkalosis. So here is the option B, respiratory acidosis is the correct answer, because here pH level is automatically it was dropping and PCO2 level is increasing, so it indicates respiratory acidosis. Next move on to 111 question, that is nipple confusion is in a situation where the infant is option A, accept the artificial as well as mother's nipple, option B, accept the mother's nipple but refuse artificial nipple, option C, accept the artificial nipple but refuse the mother's nipple, option D, refuse to feed or at all. So here correct answer is option C. Next move on to 112th question. Classical symptoms of invasive cervical cancer is hematuria, back pain, post-coital bleeding, option D, anemia. So here answer is option C, post-coital bleeding. Next move on to 113 question. The irregular overlapping of the cranial bones on the another due to liquefaction of the brain matters of fetus is called as option A, Jacquemin sign, option B, Spalding sign, option C. Next move on to 114th question. What will be the approximate body mass index of a woman with a weight 70 kgs and height 155 centimeters? So option A 26.1, option B 29.1, option C 25.2, option D 24.6. So here answer is a 29.1 is the correct answer. Move on to 115th question. What will be the incidence rate if there are 500 new cases of any illness in a population of 30,000 in a year? Option A 1.42 per thousand, option B 14.2 per thousand, option C 16.7 per thousand, option D 1.67 per thousand. So here answer is option C 16.7 per thousand. The formula is 500, the new cases upon population into 1000 is a formula. Next move on to 116th question. All of the following foods have a high glycemic index except option A, brown rice, option B, cornflakes, option C, baked potato, option D, white bread. So answer is cornflakes, option B is the correct answer. Next move on to 117th question. Which one of the following type of undernutrition is indicated by the Z score below 3SD of the median WHO child growth standards? Option A, underweight, option B, stunting, option C, wasting, option D, severe acute malnutrition. So answer is option D, severe acute malnutrition. Move on to 118th question. Which one of the following is the measures of overall disease burden expressed as a number of year lost due to ill health, disability or early death? Option A, high adjusted life expectancy, option B, quality adjusted life year, option C, disability free life expectancy, option D, disability adjusted life years. So answer is option D is the correct answer. 119th question. Numerators for a calculating a neonatal mortality rate in a neonatal death within option A 28 days of life, option B 45 days of life, option C 75 days of life, option D 90 days of life. Here neonate means within 28 days, so it indicates option A 28 days of life is a correct answer. Move on to 120 question. Which one of the following drugs used for the treatment of malaria is a contraindicated in the pregnancy? Option A, chloroquine, option B, primequine, option C, quinine, option D, sulfoxetine plus pyrimethamine. So option B, primequine is the correct answer for 120th question. Next move on to 121 question. Which one of the following is not a component of epidemiological triad? So option A environment, option B agent, option C host, option D disease. So answer is option D disease in the epidemiological triad. Option A environment, agent, host, these three will be available, but option D disease it won't be there. Next move on to 122nd question. During pulse polio immunization, auxiliary nurse midwife has noticed that one vaccine while monitor the color of square inside the circle is darker than the circle around it. What should be her action? Option A administer the vaccine to the children from the same vial. Option B administer the vaccine from the same vial after shaking it. And option C put the vial in a ice box for some time and then administer for the same vial. Option D should not use this vial for a vaccination. So here the rationale is already that vaccine is damaged already, that it was already out of the color, like color was shaded. So in that situation we should not use that vial. So answer D is the correct answer. Should not use this vial for the vaccination. Next 123 question. Match the list 1 and list 2. Select correct answer. So list 1 is a Bordetella pertussis, Salmonella typhi, Clostridium perfringens, and option D Flavivirus fabricus. So here Bordetella pertussis causes whooping cough, and Salmonella typhi is enteric fever, and Clostridium perfringens causes food poisoning, and option D Flavivirus fabricus it will causes a yellow fever. So if we will compare like this, option B 3, 4, 2, 1 is the correct answer for 123 question. Next move on to 124th question. Which one of the following services should ideally form the base of the health service pyramid? Option A clinical preventive services, option B population based healthcare services, option C secondary healthcare services, option D tertiary healthcare services. So here answer is option B population based healthcare services is the correct answer for 124th question. Move on to 125th question. Community-based assessment checklist CBAC for early detection of a non-communicable diseases is to be filled by A. Option A medical officer, option B staff nurse, option C ANM, option D ASHA worker. So here answer is ASHA worker is the correct answer for 125th question. Next move on to 126th question. Which one of the following are the team members of the health and wellness center at sub-center level? Community health officer like a mid-level health provider. Option 2 ANM, option 3 ASHA, and option 4 is Anganwadi worker. So here answer is option A, 4 of the correct answer. MLHP person will be available, ANM will be, and ASHA worker will be available, and Anganwadi worker also. So 4 make a team and they will work under as a health wellness center. So these are the correct answer for 126th question. Next move on to 127th question. Which one of the following code is not correct for the triage system adopted in a triage of disaster management in India? So option A red color high priority treatment, option B yellow indicates a medium care priority, and option C is a blue indicates a ambulatory patients, option D black indicates a dead and morbid patients. So here we will use a red color also will use, and yellow color will use, and black also will use, but in the triage system blue color it won't be available. So answer is option C, blue indicates a ambulatory patient. So answer is a C. Next move on to 128th question. Under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, how much covers for a family per year it provides for a secondary and a tertiary care hospitalization? So here option is 2 lakh, option B 5 lakh, option C 7 lakh, and option D is a 10 lakh. So here AB PMJAY it indicates option B 5 lakh is a correct answer. Move on to 129th question. Discouraging a children from adopting harmful lifestyle for the prevention of non-communicable diseases is an example example of? Option A, primordial prevention. Option B, primary prevention. Option C, secondary prevention. And option D is a tertiary prevention. So here answer is a option E, primordial prevention, because here there is no already causes or effectiveness. Next, move on to 130 question. Screening of a subgroup population for a particular disease is called. Option A, mass screening. Option B, selective screening. Option C, high risk screening. Option D, multiphasic screening. So here answer is a option A, mass screening is a correct answer for 130 question. Move on to 131st question. Which one of the following is a indication of a prevalences of a contraceptive practices in the community? So option A, total fertility rate. Option B, general fertility rate. Option C, couple protection rate. Option D, net reproduction rate. So answer is option C, couple protection rate is a correct answer for 131st question. Move on to 132nd question. Which one of the following occupational disease occurs due to sugarcane dust? So option A, anthracosis. Option B, silicosis. Option C, farmer's lung. Option D, bagosis. So here answer is option D, bagosis is a correct answer for sugarcane dust. Next, move on to 133 question. Which one of the following vaccines is sensitive to freezing and should be protected from a sub-zero temperature? Option A, oral polio. Option B, BCG. Option C, Japanese encephalitis. Option D, cholera. So here answer is option D, cholera. Next, move on to 134th question. Paris patches are present in a option A, stomach. Option B, duodenum. Option C, jejunum. Option D, ileum. So here correct answer is option B, option D, ileum is the correct answer. At the terminal ileum we can find a Paris patches. Next, move on to 135th question. The type of joint where movement takes place about a single stationary axis and is largely restricted to one plane are called as option A, plane joint. Option B, hinge joint. Option C, ellipsoid joint. Option D, saddle joint. So here answer is option B, hinge joint is a correct answer for 135th question. Next, move on to 136th question. Which one of the following hormones is secreted by the neurohypophysis that causes uterine contractions? Option A, estrogen. Option B, progesterone. Option C, prolactin. Option D, oxytocin. So oxytocin is a answer for this question, correct answer, because neurohypophysis is a posterior pituitary gland. So posterior pituitary gland will release oxytocin. Next, move on to 137th question. Which one of the following plasma protein has the function of maintaining the osmotic pressure? Option A, hepatoglobin. Option B, transferrin. Option C, albumin. Option D, ceruloplasmin. So answer is option C, albumin. Albumin will maintain a osmotic pressure in the plasma. Next, move on to 138th question. Which one of the following condition can cause steatorrhea? Option A, one is a pancreatic enzyme insufficiency. Second is a disease affected small intestine. Option 3, bile acid deficiency. Option 4, insulin deficiency. So except insulin deficiency, remaining 3 conditions it causes steatorrhea. So correct answer is option C, 1, 2 and 3 also correct answers. Next, move on to 130. All of the following are the theories of motivation except option A, self-determination theory. Option B, Hull's theory. Option C, psychoanalytical theory. Option D, Sternberg's triarchy theory. So here answer is option D, Sternberg's triarchy theory is the correct answer because it is an intelligent theory. So next, move on to 140th question. The highest level of growth needs as per Maslow's hierarchy of needs theory is option A, aesthetic. Option B, cognitive. Option C, esteem. Option D, self-actualization. Here they have asked needs according to Maslow's hierarchy, highest level. They didn't ask highest priority. If they have asked highest priority, then it will come as a physiological, but here they have asked highest level. So answer is option D, self-actualization. Next, move on to 141 question. and a IQ score of 90 is a qualified as a option A borderline, option B average, option C is superior, option D bright normal. So here answer is option B average is a. Move on to 142 question. According to a sigmoid Freud's theory of a psychoanalytical, all of the following are the structure of personality except option A conscious, option B id, option C ego, option D superego. So option A conscious, it won't be there in a psychoanalytical theory. Remaining all three will be available in psychoanalytical theory. Next move on to 143 question. The conflict that occurs due to having to choose between two positive goals which are equally attractive at the same time is called option A approach avoidance conflict, option B double approach avoidance conflict, option C avoidance conflict, option D approach conflict. So here both are positive only, both are correct only, so then they are taking decision means approach conflict is a correct answer, that is option D. Next move on to 144 question. The type of family in which father has a highest status in a family who controls the social life of family is called patriarchal family, and option B matriarchal family, option C patrilocal family, option D patrilineal family. So here father is the dominating, like a father is the head of that family, so then option A patriarchal family. If mother is in a head of the family, then it indicates a matriarchal, but here is father. Option A is the correct answer. Move on to 145 question. Which one of the following are the way of actualization? Option 1 trade and commerce, option 2 industrialization, option 3 education, option 4 conquest. So select the correct answer. So 4 will be comes under as a actualization. So option D 1, 2, 3, 4 is the correct answer. Next move on to 146th question. Which one of the following are essential amino acids? Option C leucine, option 2 is a tryptophan, option C that is methionine, option 4 is a cysteine, option 5 is a histidine. So select the correct answers. So here except cysteine all are comes under as essential amino acids, but option 4 cysteine is a non-essential amino acid. So here answer is option C 1, 2, 3 and 5 is the correct answer. Move on to 147th question. Match the first and second list. So first list is a corneal cirrhosis, option B keratomalacia, option C conjunctival cirrhosis, option B Bitot spot. So here we can compare means corneal cirrhosis, it indicates a corneal dull, dry and non-wettable and eventually opaque. So keratomalacia means cornea became soft and may burst open. So conjunctival cirrhosis means conjunctiva became dry and non-wettable. So Bitot spot means triangular, purely white or yellowish foamy spot on the bulbal conjunctiva. So here if we'll see like this means option C is the correct answer. 2, 3, 4, 1 is the correct. Next move on to 148th question. Match the list 1 and 2 and select the correct answer. Here list 1 is a vitamin D, option B niacin, option C vitamin C, option D phosphorus. So we need to compensate, like we need to match their functioning. So if we'll match like this means vitamin D function is promote intestinal absorption of calcium and phosphorus, and next niacin function is essential for the metabolism of carbohydrates, fats and protein, and vitamin C function is act as an antioxidant, and phosphorus function is essential for formation of bones and teeth. So here if we'll see like this means option B is the correct answer. 2, 1, 4, 3 is the correct answer. Next move on to 149th question. Which one of the following serum enzymes is used in the clinical diagnosis of acute pancreatitis? Option A, lactate dehydrogenase. Option B, alanine aminotransferase. Option C, aspirate aminotransferase. Option D, amylase. So here mostly we'll use as a amylase and lipase, but here amylase is there, means that is correct answer. Option D, amylase is a correct answer for 149th question. Next 150th question. Which one of the following is the major immunoglobulin in a human serum? Option A, IgA. Option B, IgD. Option C, IgG. Option D is a IgE. So here correct answer is option C, IgG is a correct answer. IgG have a more immunoglobulin, major immunoglobulin in body, and IgA it will be available in a breast milk, and IgE it will be available in any allergies time only. So IgM, one more immunoglobulin, that is it is a biggest immunoglobulin. So these are the regarding immunoglobulin. So these are the 50 questions which I divided in a first part. Second part I will upload in tomorrow, because if I'll make 150 questions in a one video, it will take a more time in a video. So that's why I was divided in a 3 parts. If you want to get a notification whenever I was uploading video, then just do like, share and subscribe to our channel. Then definitely whenever I will upload, instantly you will get a notification. So it can be useful for you. So I hope all you got your answers and comparison, everything. Thank you so much for watching.